My name is Radhika Shah. I am the Program Director for the Pulmonary and Critical Care Fellowship at University of Tennessee College of Medicine, Chattanooga, and Erlanger Health System. This is the perfect place to start a fellowship because of the diversity of patients that we see at Erlanger and the high acuity of patients that we see at Erlanger. In the last few years, we've also had an increase in the diversity of the faculty that we've been able to recruit, and we have a good mixture of senior and junior faculty from all over the country that I think make this a perfect training environment for fellows. We are hoping to create a culture in our fellowship of really high, rigorous clinical and educational standards for the fellows, but in an environment that's safe and welcoming in order to create a learning environment that is comfortable for all fellows.
I'm Aaron Cohen. I'm a critical care intensivist, and I'm the director of the intensive care unit in the medical intensive care unit here at Erlanger. As the region's highest acuity ICU, we are the regional referral center for our area. And here at Erlanger, we take patients with a pretty wide spectrum of critical illness, from neurologic, septic shock, respiratory ailments, and more. And we would expect our learners, our fellows that come out of this program, to be well versed in all of those facets of critical care medicine and be able to work in really any level of ICU around the nation and provide excellent care. Chattanooga is a great place to train. Erlanger is a wonderful hospital with wide support from various specialties. We've got a number of training programs here, and so fitting into that as a pulmonary and critical care fellow, you'll get exposure to all the other specialties that you need to rely on working in the ICU. The city itself is wonderful. It's great. As a young professional living here, we've got great outdoor activities if you like hiking or water sports, as well as a great emerging food scene. It's a growing city, and we're pretty well located between Nashville and Atlanta for those who want to get out and enjoy the big cities once in a while.
I'm Ann Maynardi. I am a specialist in pulmonary and critical care, and I'm the Associate Program Director for our new Pulmonary and Critical Care Fellowship. Research is a priority for our fellowship, and we know that residents come with varying levels of experience and skills in research from their residency, and various levels of interest in research and varying degrees of how much they want to incorporate it into their career going forward. So we plan to pair you with a mentor early on in your fellowship so that you can establish your goals and how you want to incorporate scholarly activity into your training. We have a lot of resources here because this is an academic institution paired with the University of Tennessee at Chattanooga and with the greater resources of the University of Tennessee Health Science Center based in Memphis, which allows us to offer experiences in clinical research, in quality improvement. If you want to focus on teaching and curriculum development, medical education, there are a lot of different options. We have a medical library here based in the hospital. We have statisticians that we can work with, pharmacists that we can work with who are dedicated to research. So there are a lot of opportunities. So when you have your dedicated 6 months of research time, you won't be sort of floundering. We're gonna establish your plan early on with your mentor and make it happen.
My name is Dr. Patrick Koo. I'm the Division Chief of Pulmonary Critical Care and Sleep Medicine. We offer very vast opportunities to do many procedures here. I would say that fellows would have all necessary training for different procedures that they will need when they leave here. They can use it in a community hospital or even in an academic hospital. These procedures include chest tubes, intubation, bronchoscopy, pleural catheters, and advanced bronchoscopy as well, such as using endobronchial ultrasound.
We are very excited to start this fellowship, and our goal is to be able to train fellows to be able to practice in any sort of practice setup throughout the country, and we welcome all applications.